Well, you're most welcome to today's talk. It's Thursday, the 9th of September today. Now, there's quite a few things that we've been wondering about since the start of this pandemic, and some definitive numbers are going to come through now as we sort of look back at the situation, things we speculated about for a long time when we were wondering how severe the pandemic was going to be. And here's some interesting data from the United States, just published in the past few days. So let's take a look at this just to start us off. Burden and characteristics of COVID-19 in the United States during 2020. So this is now complete data for 2020. Now, United States in 2020 had the highest number of reported cases or deaths in the world. Now, there is some debate as to whether that's true or not, but in terms of official reporting, the United States reported more cases and deaths than any other country in the world. Not too surprising with a large population. Now, in the light of subsequent antibody studies, we can now look back and see how many people were actually infected. So these modelers have taken into account information from the Centers for Disease Control, information from quite a few places, the National Institutes of Health. They put all that together with some really quite clever statistical models that I don't fully understand. And here's the data. So March 2020, they picked up 11.3% of positive cases. In other words, the vast majority, of course, weren't picked up as being positive. So that meant the number of real cases, the actual infection fatality rate was way higher than the case fatality rate. And we did discuss this at the time, to be fair. But 11.3%, in other words, pretty well a fifth, just over a fifth of people were being, in fact, no, it's less than that. It's a tenth, isn't it? Just over a tenth were being picked up. So the majority were, nearly 90% not being picked up. That's because a lot of people were minimally symptomatic or asymptomatic, and of course testing was limited then. But by the time we got to December, we're picking up in the United States about a quarter of cases, 24.5% were being picked up. So the population susceptibility at the end of the year was still 69% of the American population was still completely susceptible at the end of 20 to the end of 2021. Now, what that is now is a bit hard to say. Now, in the UK, we looked at this yesterday. It was 94% of people have got some antibodies to SARS coronavirus 2 in the United Kingdom. Quite what that is in the United States, we don't really know. Probably comparable. But of course, we know it's not the main factor now because people need 2 doses of vaccine to be well protected against the Delta variant. But that's from the United States then. Now, so basically 31% of the population have been exposed in 2020, but that's 100 million people. We did speculate on these kind of numbers at the time, but they seemed exaggerated at the time. But looking back, we were actually right in our speculations. I remember talking about that 100 million figure around about the new year, and it turns out we were actually correct on that. 100 million people have been exposed by basically New Year 2021, the end of 2020 in the United States. Pretty large number, but still leaving many unexposed, of course, which is the point we're making here. Now, the prevalence rate rose above 0.8% in some areas by the end of 2020 because, of course, there was a big peak at the last winter time. And in some metropolitan areas, it was 2.4%. So that was kind of the peak prevalence at the end of 2020 during that wave that we've looked at graphics for many times. So I'm not going to show them again just now. So quite interesting, really. And of course, this gives rise to some final infection fatality rates. 0.3% by the end of 2020. Now, we did say the case fatality rates, of course, at one time seemed to be about 5, 6, 7, 8, 9%. That's the percentage of people that tested positive that died. And we knew at the time that was way overestimated. But now we can say fairly definitively, of everyone that caught the virus in the United States in 2020, 0.3% of them unfortunately died. So worse than we'd thought at the start of this pandemic, that is, to be quite honest. We didn't really expect overall fatality rates to be as high as that. So infection fatality rate, the actual number of cases of people that were actually infected, whether we knew about it at the time or not, 0.03% by the end of 2020. Now, still in the States, new information from the American Academy of Pediatrics. This just came out about 4 or 5 days ago, I think. As of the 2nd of September, the data they're publishing, over 5 million people have tested positive. Over 5 million children, have tested positive in the United States since the start of the pandemic. But 252,000 of those were in the past week. So the proportion of children becoming positive is increasing. No question about that at all in the States. And we know that's the same in the United Kingdom. It really is. The parallels between the United Kingdom and the United States really are quite level in so many situations. We're seeing exactly the same sort of spread in the younger age groups now in the United Kingdom as the United States, indicating, of course, there's lots we can learn from each other, but there are differences in policies, as we'll see in a minute. So that is the largest number. So that 252,000 is the largest number of child cases in a week ever since the start of the pandemic. So there's more children getting infected now than there has been since this whole pandemic started. So since the pandemic began, children were 15.1% of total cumulated cases. Week ending the 2nd of September, 26.8% reported COVID-19 cases. So the proportion's gone up from 15.1% to 26.8% of the total people diagnosed. A big increase in the number of children being diagnosed positive, as in the UK and indeed as in a lot of other countries around the world, particularly those that have had the pattern of vaccine rollout, starting with the oldest first that we've seen in the UK and the United States. So 2,400 children were hospitalised nationwide at the end. That was actually as of last Tuesday, the week up to last Tuesday. 2,400 children were hospitalised nationally in the United States. And again, the highest number of children in hospital in the whole pandemic so far. There's never been more children in hospital in the United States suffering from COVID-19 or complications of COVID-19 ever. Hospitalizations, 24 states. Now, very frustrating, we're not getting data from all states here, but from 24 states and New York City, children ranged from 1.6 to 4.1 of the total cumulated hospitalizations. So children we see in the minority of people hospitalised, but it's not a small minority. So up to 4.1% in some areas, down to 1.6 in other cases of the total number of people actually hospitalised. And 0.1 to 0.9 of all child COVID cases result in hospitalisations. So of the children that got infected, 0.1 to 1.9% of those children were hospitalised. And again, the numbers are small, but they're not insignificant at all. And, there's a lot of anxiety in parents and sickness in children here. Mortality in children for 45 states, 0%, which of course is wonderful, to 0.27% of all COVID-19 deaths. So it's the vast minority, but of course child deaths are a particular tragedy because so many years of life are lost. 7 states reported 0 child deaths, and that gives us 0 to 0.03 of all child COVID-19 cases resulted in death. So the numbers are low, but they're not insignificant. No definitive data to say they're higher with Delta variant. This seems to be the result of more children being infected at this period of time. To put it quite crudely, it's a bit of a percentages game. A bit of a simple percentages game of the number of children that are infected, and of course it's not a game. Now, vaccinated children, half of children aged 12 to 15 have received 1 dose of vaccine in the United States. 58% of children 16 to 17-year-old have received at least 1 dose. Now, in the UK at the moment, the situation about childhood vaccinations from 12 to 15 is thoroughly unsatisfactory. The JVCI, the Joint Committee on Vaccination and Immunity, basically they've just sort of seemed to have decided not to decide. They've said they're not recommending it. And that's dumped the decision down onto the Chris Whitties and the other medical officers of Northern Ireland, Wales and Scotland who have to make this decision, and they haven't done so yet. And I can't say I'm surprised because it's quite one heck of a decision for them to make, really. Very disappointing that the JVCI should not have made this decision, but there's certainly people in the JVCI that don't advocate or don't really favour vaccination for children. So that's probably what's going on there. Politicians are for it, and it looks like individual families and children will be left to decide for themselves. That's probably what's going to happen. So a bit of a cop-out, but it looks very much on individual decision-making in the UK. More on that hopefully in the next few days, but again, not yet. We're not there yet. Back to the United States, though, Anthony Fauci, National Institute of Allergies and Infectious Diseases, if we didn't know by now, we've got to get the school system masked, direct quote, that's what he's saying. In addition to surrounding the children with vaccinated people. So there you go. We don't want unvaccinated people around children. We want this kind of, as much as possible, a bit of a fire break around children if we can get it. That's the solution. Direct quotes from Anthony Fauci. Now following on from this is really quite interesting. And is this the way things are going to go? Well, Los Angeles mandates, we believe today. Now, I did check this just before I came on to do this broadcast. And they haven't passed it yet, but we believe they're going to. We believe this is going to happen. So Los Angeles is going to mandate today vaccination for school children, for school attendees, and that's 600,000 children would have to get their first shot by the 3rd of October, we believe, and the second shot by the end of October. Again, going for that small gap. I'd prefer a slightly longer gap, but that's what they're going for. Los Angeles County, smaller area, of course, had mandated it since last month. Now, is this the way it's going to go in other parts of the United States, other parts of the world? We can say at the moment this is the way it's going in that particular geographical area. Now, I know this is controversial, so we've got our poll running at the moment. Now, so far, 61,000 people have expressed an opinion on this, so thank you for that. This is really quite fascinating. I'm checking this every few hours to see if it's changing. And actually, it hasn't changed for quite a long time. So vaccination should be mandated for all adults, ? John is asking. 61,000 votes. 27, yes, government should mandate vaccines for all. 27% of you, good people, believe that. No, government should not mandate vaccines for all. 73% of you people believe that. I haven't voted. I'm leaving that one to you. Now, that 27 to 73%, it's starting to get really interesting because since about 20 or 30,000 people voted, that percentage hasn't changed, or only by a percent or two. So there you go. It's 27 against, 27 for mandatory vaccinations and 73% against. So do vote on that. The direct link is there. It is, I do find this very interesting what people think. Most of you are coming out against mandatory vaccinations. There's not an absolute right or a wrong. We could spend weeks arguing about both sides. It's an opinion. So there's the link. Do exercise your democratic enfranchisement and vote on that. I don't know who's voting. I have no names. I don't even know what countries you're in. It's just a cumulative sort of blind data, so we don't know that. And I'm pretty sure YouTube doesn't know either, so it is genuinely an anonymous opinion as far as I understand it. Certainly from my point of view it is. Now, Pascal Soret, AstraZeneca chief executive, talking about booster doses. Now, this is interesting. Now, you might remember that the Oxford AstraZeneca vaccine, the Oxford scientists made a deal with Oxford AstraZeneca, with AstraZeneca at the start of this, saying that for the duration of the pandemic, they would agree not to make a profit on vaccination, and we believe that's being upheld. We believe the doses are still selling for around about $3 each, of massive implications to COVAX and international rollout. $3 per dose of vaccine, not for profit. So that is the position. That hasn't changed since the start of the pandemic. So Pascal Soret, chief executive of AstraZeneca, said the UK is still a few weeks away from being able to decide. We haven't got enough data to decide if we're going to need a booster dose. And of course, you've got to think, if he's not making any money out of it, then presumably he's no financial interest in this. Not that we're saying that would influence anything, but his scientific opinion, and this is a scientific opinion I believe he's expressing, is we haven't got enough data yet. Moving too quickly to boost across the entire population would deprive us of these insights. The opportunity to get this data would be lost because it would be clouded by this variable of some people having the extra vaccine, because it doesn't want the decision to be on limited data. So I've got to say that makes scientific sense. Leaving this important decision to rest on limited data would not be ideal. And of course, there's a lot of implications for the health service because there's a lot of people involved and a lot of administration involved and a lot of cost involved in additional vaccine rollout. The politicians seem really for it. So in the UK, for example, Zadim Sahar, with the vaccine minister, seems to be very much for a third dose. The health minister seems to be very much for a third dose. So Sajid Javid seems to be very much for a third dose. So politicians seem for it, but Chief Executive of AstraZeneca saying not yet. But we're told the NHS is ready to go on a third dose. Now, this chap here, Pfizer's Chief Scientific Officer, Philip Dormitzer, and of course, the Pfizer vaccine is sold at a profit. We know, we've looked at the profits are huge, but Pfizer seemed to be encouraging booster doses. Dismissed criticism that his company should have produced a more potent vaccine. So the idea here is that if the vaccines were more potent and did a much better job the first time, then there would be no need for governments to purchase a third dose of vaccine. Interesting ideas. So we don't have a tweaked vaccine yet. I expected one. I really expected we'd have a vaccine which was specific. We were promised by people that make the RNA vaccines and the adenovirus vector vaccines that it would be a relatively straightforward job to tweak the vaccine to the genetics of the Delta variant, but this doesn't seem to have happened. It's gone deathly quiet on that because the booster doses of vaccine that are being proposed at the moment are the original vaccine that we started off with way back last winter. So why hasn't a more specific booster dose been engineered? I haven't heard anything about it. If you've heard anything about it, do let me know, but I've been looking and I haven't found anything on that yet. So it seems a bit strange. Now, Sarah Gilbert, of course, the leading light in the Oxford AstraZeneca vaccine, Dame Sarah Gilbert, Professor Sarah Gilbert, she's been wading in on behalf of the people that aren't responding to the vaccine, and she makes a really good point. In the UK, there's 3.8 million people classed as clinically extremely vulnerable. That is a lot of people, 3.8 million, and there'll be comparable in large amounts in the United States and other countries on a per capita basis, of course. In people who've been vaccinated and have 2 doses, Professor Gilbert says, they will be well protected against disease that is severe enough to put them in hospital and against death. Mostly. Not entirely true, we are getting breakthrough infections, but mostly, of course, she is correct. But then she goes on, this is the point she's trying to make really. There are unfortunately some people with particular health conditions that mean they just don't respond to a vaccine. They don't make the immune response. People without a spleen, or people with immune deficiency disorders, or people on treatment for cancers, or people with immunosuppressing drugs, people on large doses of steroids for other medical conditions. They're just not responding to this. And that's a problem. And they're going to have to make sure that they are protected, probably by shielding again, she was thinking, if there's a lot of spread of this virus, and there is. So the problem here is that this virus, a lot of people are saying now everyone's going to get it. And if that includes 3.8 million people in the UK who are immunologically vulnerable, then that is a lot of people potentially going into hospital over the next few months as this virus becomes endemic and ubiquitous. And that's the same everywhere. So that is a concern for large-scale hospitalizations over the next few months. These vulnerable people. Okay, just a few other quick things for today. So the UK actual government guidance on protection people who are clinically extremely vulnerable from COVID-19, updated 3rd of September. Now, we waited a long time for this update. It doesn't actually say very much. So we are advising clinically extremely vulnerable people as a minimum to follow the same guidance as everyone else. Wow. You may wish to think particularly careful about additional precautions you may wish to continue to take. I mean, this is saying nothing. It's saying nothing. So what are these people to do? They may wish, they may consider, and I'm saying I believe they are at risk. If people can't avoid this virus, and people with compromised immune systems, 3.8 million of them in the UK, are going to be at significant risk. Now, just a few points that caught my interest. Sweden is going to remove remaining restrictions at the end of this month. We looked at Sweden. Numbers of cases in Sweden, Norway, Finland, Denmark, all roughly comparable, all pretty well vaccinated, so that's what they're doing there. Vietnam, now they started vaccinating with Moderna vaccine and they ran out. So people that had the first dose of Moderna vaccine are going to get Pfizer as a second vaccine. Now, we're not doing this in most other cases, but the medical authorities in Vietnam have decided basically that it's safe to mix and match Moderna followed by Pfizer. I don't know of any medical reason not to do that, any immunological, biological reason not to do that. And the Vietnamese government have made that decision. Of course, we have to follow whatever our national guidelines say, but I thought that was interesting from Vietnam. It probably does reflect that there's no medical, biological contraindication, at least in this case, to giving Moderna followed by Pfizer. Switzerland, surging ahead with certification, which is going to be enforced, we believe. COVID certificates, proof of vaccination recovery or a negative test. Novavax. Now, Novavax has been so frustrating. This is the protein-based vaccine, you probably remember. And we had really high hopes for it. And it's passed all its clinical trials and everything, but the problem is the manufacturing has not yet been certified. So the reason it's not being certified is not because there's anything to do with the vaccine. That seems absolutely fine. It's the manufacturing processes. So very frustrating. This hasn't come along yet. But what they're doing now is having a single vaccine that will combine a SARS coronavirus 2 vaccine with an influenza vaccine. And I think they're planning on rolling that out as one shot. So that will be interesting to see what comes up there. So quite a few interesting points on the pandemic really at the moment. It just keeps unfolding. More and more information just keeps coming out, and some things you can make sense of from last year, and other things new questions are added. Concerns over children in the UK and the United States. We know not many get sick, but we know so many more are getting infected now. And one of my main concerns at the moment is clinically vulnerable people will be exposed to this virus over the next few months. And that could give rise to significant hospitalizations and potentially deaths. So even though the cases might go down towards the end of the year, hospitalizations could remain high because more of these vulnerable people make up the proportion of hospitalizations. And the government really isn't advising very much specific for them to do about that. So I'm not really quite sure what they're going to do. So that's where we are at the moment. That'll do us for today, and thank you very much for watching.